Good evening, everyone. It's Myth again. It's Thursday, August 7th, post-op surgery day 3. And tonight I don't have on the cervical collar, but I wanted to show you how the Bone Growth Stimulator looks when it's on. And you have to wear it every day for 30 minutes and preferably about the same time every day. And last night was the first time that I wore it, and it was very calming and very soothing, very relaxing. So you can see it on the back of my neck there. And its purpose is to just make sure that the bones fuse well through a magnetic field that stimulates the neck to heal. So I'm kind of appreciative of that, and I'll just let you know how my day is gone. As Dr. Patel told me, I would have more problems after day 2 because some swelling would set in. So I've been particularly hoarse. Today I don't really feel bad, but I have been hoarse and just been eating small soft meals and drinking lots of cold fluids to see if that would help with the swelling. Also, I've been continuing to use my incentive spirometer as often as I can, maybe every 2 hours, and that's important to make sure that my lungs stay open. And again, I'll demonstrate for you to suck the air in and try to get it up to like 2,000, I think that's milliliters. So that's very important after surgery to make sure you don't get anything in your lungs or blood clots or anything. Here's the timer on my bone growth stimulator, and it'll tell me exactly how much time that I have left with it on. And when it's finished, it beeps and it goes off. So that's pretty, no problems with that at all. I mean, it's pretty much standard treatment. So I've kind of slept as my neck dictated. I'll go to sleep for a few hours and then I'll get up. I think one of the most uncomfortable parts with sleeping and how to sleep is when you wake up, sometimes your neck may be in an awkward position. So I have my bed stacked with pillows, and I'll also be in the recliner upright as much as possible. I haven't slept laying down at all. So that's been okay for me because I don't want to do really anything to strain my neck. So I walked today, and of course they said walk around the house, but you have to walk. And I've walked as much as I possibly could. As a matter of fact, I did get on the treadmill at a level of 1.5, and I walked for about 5 minutes. And I didn't break a sweat or anything, but I wanted to make sure to keep the circulation going because the walking is important, and they did stress that as well. And of course, with it being day 3, my throat is a little sore. And I really believe after they take the little drain bag out, whatever is left drains back into your body. And after that, I got the hoarseness. But of course, Dr. Patel has already assured me that that's normal, and it's going to resolve itself within the next couple of weeks. But it's been a little harder to swallow, but it is getting better. So today I had a little egg drop soup. I had some fondue and bread and just soft stuff that I ate to make sure that I didn't do any damage to my self or my system. As it comes to the pain medication, I'm really anxious about weaning myself off of it. When I was in the hospital, I was on the pain medication for every 4 hours, I think. And when I got the prescription to come home, it was every 6 hours. But I'm stretching it to like every 7 or 8 hours to see how long I can go. I haven't been in excruciating pain, and I'm really happy about that. Now, I don't know what would happen if I went all night and woke up in the morning without having medication for, say, 12 hours. But I'm going to get to that point because one of the reasons that I had this procedure was because I don't want to be on pain medication. But right now, with just recently having surgery, I have had to be on it. So I've just been drinking cold liquids and trying to keep my vocal cords warm, and gotten real good care from family and friends and people coming by. And I'm just so glad I haven't been able to lose my independence. You know, I can still move around my house and do the things that I need to do to be independent. But I'm really grateful for all the help from friends and family who have called, texted, emailed, come by, bought food, and just taken really good care of me. So I'm at the point now where I'm just going to take really good care of my neck so I can heal properly. I'm going to wear this contraption every night because it's doing something for my neck. And I'm just really optimistic about my road to recovery. And again, I'll say that's the reason that I'm here. The reason that I'm posting the YouTube videos is because somebody out there who may be very reluctant to have the surgery and feel like they're going to be in pain for the rest of their lives. I want to be able to show you my experience down through the months, so you'll be able to see that ACDF surgery is well worth it. I'm not going to kid myself because this isn't the neck that God gave me, but it's the new neck that's pain-free. I don't know if I'm going to be able to predict the weather. I may or I may not. All I know is that I'm not going to have excruciating arm pain. I'm not going to have the headaches. So we'll see as time goes on, and I do appreciate your coming. If you have questions about this contraption I have on my head or anything else that I've gone over during the course of the surgery, do leave me a message here on YouTube, and I'll respond back as soon as I can. And I appreciate your attention and your time and your interest, and hope that I can do something to help you make a very important decision to have the anterior cervical fusion surgery, discectomy surgery. So, without any further ado, I'm going to see you all probably in the next day or two. Take care, and we'll be looking forward to chatting with you. Thanks.